felt much more assured that whatever I was dealing with in terms of this problem was being looked at from a much more holistic approach, and a much more sensitive approach. As you can appreciate, when somebody who has been quite healthy for the vast majority of their adult life is suddenly confronted with the possibility of any form of cancer, alarm bells ring, and you can very easily go into a defensive mode and become very worried about how you deal with this issue. My anxiety was not helped by the process I was experiencing through the health service in the UK. On the contrary, when I spent time in Thailand with Dr. Pilant, just from a personal, mental, emotional, spiritual point of view, I felt a lot more calmer and more positive about the way in which the problem could be approached. And as a result, decided that it was much better to go with the integrative medical approach that was being proposed by Dr. Pilant.
Alright, so let's go back a little bit when you were first diagnosed with prostate cancer. How did you feel, and also what were the recommendations, the advice, medical advice that you received?
I suppose the first thing that you feel when you are presented with this information is shock. Just in terms of initial discussions, you tend to lose sleep. You tend to focus on the negative sides. To use an old-fashioned phrase, the glass suddenly becomes half empty rather than half full. So I don't suppose I'm any different to a lot of people who have been presented with this situation. You look on the dark side of things, and your mind tends to go into overdrive as to what the outcome, the negative outcome may be of all this. Coupled with the fact, when you do some personal research on this and you look at the means of treatment that we appear to have in the West at the moment, they seem to be very draconian. They seem to be very invasive. They seem to be very, for want of a better word, poisonous to the system, because my understanding is things like chemotherapy, if that's an avenue that somebody has to go down, can be very destructive to the whole body system, as well as trying to tackle a particular form of cancer. So I very quickly came to the conclusion that I wanted to have a different way of approaching this. Not just from a physical point of view, in terms of caring for my health and well-being, but also for my mental state of mind and my emotional well-being, for want of a better phrase.